Hello, my name is Reagan Frye, and I'm a student at the University of Tennessee, Knoxville, and I will be presenting my poster on the access to behavioral care for dog families. So, in the US today, nearly 90 million dogs are our household family members, but even with the deep bonds we share with our dogs, behavioral issues like fear, anxiety, and aggression can get in the way and are actually the leading reasons people end up surrendering their dogs. We have an emerging field of research called access to veterinary care that studies how families get veterinary access, any barriers they may face, and how to overcome those challenges. But the parallel field of access to behavioral care is still largely undefined. Just like we prioritize preventative medicine for physical health of our pets, like heartworm prevention or flea and tick medicine, we also must prioritize behavioral support to ensure relational well being or the health between humans and their dogs in that bond. I've had the wonderful opportunity to work with the Center for Pet Family Wellbeing and Every Dog Behavior and Training as they work together to merge health equity research with behavioral expertise and build this new access to behavioral care framework. While the access to veterinary care keeps a pet's body healthy, access to behavioral care is there to keep the human animal bond healthy. This means everything from proactive care like early socialization and training to clinical support for more serious issues like aggression or separation anxiety. Our goal is to make sure that every family, no matter their income or where they live, can get the behavioral help they may need for their dogs. So to determine what is actually preventing families from accessing training, we're using a four-step or a four-phase design. We're currently in phase one, and I've been working to support this work by looking at existing national research on medical equity to make sure our questions are consistent with what we already know about barriers to care. This review will support the team as they put together a team of behavior scientists and expert trainers to make sure that the survey actually captures the real world nuances of dog behavior. Phase 3 will be all about programming and pilot testing the survey on Qualtrics to make sure that our questions are clear and culturally sensitive. In Phase 4, the team will roll out a national survey to reach dog families from all walks of life across all the regions of the country. In lieu of survey results, since we're still in phase one, I'm sharing the anticipated results based on current literature and access to care findings. The numbers show us just how high the stakes are for these dog families. A study from Purdue University from 1996 determined that when owners receive helpful behavioral advice, they're actually 94% less likely to surrender their dogs. More recent research from 2022, the University of British Columbia shows a massive gap. So 15% of owners never even look for behavioral help before surrendering their dogs, and the 39% that do seek help aren't receiving the helpful advice that they need to save their relationship. So we expect our study to quantify three major systemic hurdles. First, we anticipate that service inaccessibility is one major factor pushing families to a pivotal moment where they feel surrender is a forced necessity rather than a choice that they have. Second, we think logistical hurdles like time poverty from an unpredictable work schedule or a geographic behavioral desert are additional barriers for low-income families than solely the cost of the services. Finally, we expect to see some size-dependent patterns because of how the size of a dog changes an owner's perception of risk. So families with big dogs often seek help early for safety reasons, while families with smaller dogs might wait a little longer because they see their pets as less threatening. Ultimately, this research is about more than just dog training. It's about ensuring that every family has the support they may need to stay together. By building a foundation for access to behavioral care, we're creating a framework that prioritizes relational well-being and gives families the tools to keep their pets home safe and loved for their entire lives. I would like to thank Maddie's Fund for their generous support in funding this study, as well as the Vol Intern Program at the University of Tennessee, Knoxville, through which I've had the opportunity to work on this research. Thank you for your time.